Right. Good morning. I'm Kate Steinbeck, and it is my pleasure to welcome you to the next section on behalf of Wellbeing, Health and Youth, which is a NHMRC Centre of Research Excellence in Adolescent Health. And I thank you, Jen, too, for sort of covering a lot of concepts that are very useful. We've got 4 speakers today, and we will have time for a panel discussion, which I think is really important. And what I want to do is give you a little bit of background to see why we think our CRE fits really well into this day. The full title of it is Wellbeing, Health and Youth, or WH&Y, Making Health Services Work for Adolescents in the Digital Age. And if our purpose is, as we stated, to make health services work for adolescents, then clearly we have to conduct our research very much with adolescents. And I think they have never really been involved previously in research, very, very rarely. And so, why do we have a CRE in adolescent health? The big issue, and you may not be aware of it, is that adolescent health and wellbeing dramatically declines in the second decade. So all that investment that went into early childhood starts to be lost. And our purpose is to try and change that, and we're working within health services because that's where our expertise is. And we're addressing it in the framework of the digital age. And so we need our young people to collaborate with us and drive our research. Now, this is our research plan, which very broadly looks at 3 areas. We could have very many more areas, but these are the ones that we think are very foundational to doing good research with adolescents. There's the ethics of engagement, because so many research projects are hampered by ethical issues that are quite unique to this decade. And you'll hear more about that later. We're looking at health trajectories. What is the cost of ignoring adolescent health and letting them exit from their second decade into the third decade with much poorer health trajectories? And then, because we know that health services are not really very friendly in either paediatric or adult world, looking at how, using implementation science models, we can make policy become better practice. That's an awful lot. We've done 1 year, we've got 4 years to go. I hope I can report back at the end. Now, healthy publics, which is what we've chosen to address our symposium, is, I think, something that I'm an adolescent health physician and endocrinologist, and I think we've been probably practicing this for a very long time because we recognise that adolescent health is not just whether they are physically or mentally well or otherwise on some diagnostic panel, but their health is affected from social, cultural, environmental impacts. We really need to look at how their health is altered or shaped by that. The old model of public health was very much, as Jen said, you have an expert who tells a group of people who are variably engaged in their health, or perhaps not even engaged at all, what they should be doing, and then expecting, because they've said it, that people will do it. Clearly we know that doesn't work well. And so healthy publics really recognises the importance of involving young people or participants and a very broad range of stakeholders right from the beginning to not only discuss what is researched, how it is researched, the design, shepherding it through ethics, the research itself, and then the very important part, which is obviously translation into practice. So far, we have been working hard And one of our very first outputs, working very closely with young people, is an engagement framework. How do we work with young people? And the three ovals outside, the bright reddish ones, are really our commitments to those we are working with. It will be a shared intergenerational response. We will talk in common languages and we will use technologies that adolescents and many others use. And our projects, our systems and our services are all that we are talking about are all going to involve adolescent participation and framework and input. So that's our sort of framework. And there are also values embedded in this about trust and accountability, being very inclusive. I think that's, as researchers, we've often just grabbed the easy people to research, often the worried well, rather than those who really need us, and to make sure that we are responsive and equitable.